responsible. It's like, I'm your little sister, but I'm still somehow more of a parent than you ever fucking were. I can't believe you could do this to me after everything you put me through as kids, and yet you're dying on me and ruining my life.
I can't believe you could be this selfish. Even in death, you get whatever you want.
For once, could you not make this about you? I'm dying, Eleanor. This is a lot harder for me than it is for you.
You have 6 more months. You could at least help me fix this. Instead, you're taking the easy way out. Classic Elizabeth.
Easy? You think anything about this is easy? I'm losing my hair. I'm throwing up blood. I can't eat. I can't sleep. It hurts to breathe. This is exhausting. I'm asking to die, Eleanor. Don't you realize that? Don't you at least want to let me die with dignity?
I guess I just thought I mattered more to you.
Good morning. It's nice to see you, Elizabeth.
Morning, Doc. This is my sister, Eleanor.
Good morning. It's nice to meet you, Eleanor. I didn't expect to see you back so soon. Has your pain worsened, or is your medication working?
The pain, honestly, it's bearable. It's not that. Doctor, I don't see the point in suffering when I know I'm gonna die so soon anyways. I've been thinking about it for so much time, and I talked to my primary care physician, and honestly, I've decided I want physician-assisted suicide. I don't see the point in suffering. I know I'm gonna die either way.
No point? Seriously? Aren't I point enough? Doctor, you cannot let her go through with this. It'll destroy my life. I will never recover.
What?
You want to know why? I'll tell you why. Our harebrained mother left her our entire family business. My sister is a lot of things. One thing she is not is a businesswoman. I don't know how you managed to do it, but she rounded up $10 million of family debt that she is now pawning off on me. I can't believe that you would do this.
Elizabeth, physician aid in dying is a big decision. You could have a solid 6 more months.
Eleanor, what good is 6 more months? I'm dying.
You could be using it to help me figure this out!
Stupid Mertz, please let me speak with my patient. How have you been feeling lately, emotionally speaking? Have you been more depressed now than previously in your diagnosis?
I'm dying, Doc. It's not exactly a cheerful process.
I understand, but it is incredibly important that you are clear-headed. This is a big decision. I want to respect your autonomy, but I need to know that this is the right thing for you to do.
Doctor, this is what I want. I'm dying, and I'm suffering, and I've lost so much control with the company already. I just want to be able to control this. Let me die with dignity.
You understand that you're going to have to take the lethal dose yourself.
Yes, I'm prepared for that.
Wait, you're not seriously considering this, are you? So you don't care what this will do to me?
I am here to be her physician, not your financial advisor.
Aren't you a doctor? You can't kill someone.
This is the moment where the doctor must make a pivotal decision. Will he fulfill his patient's request, or does it go against his own moral code? Now, on the one hand, he feels for Ellie and the pain that she'll be put through if he allows Lizzie this death. But, as he said before, he is here to support Elizabeth's needs, not Eleanor's. As a doctor, he must ask himself ethical questions to decide what to do next.
Lizzie, I'm going to ask you some more clarifying questions to figure out where your mind's at right now. You've expressed your concern about being in a lot of pain in the past couple months, and ovarian cancer is super painful, and in the stage that you're in, metastasized to the lungs, you're going to be in a lot of pain. So, my first question to you is, what are you willing to sacrifice to end your suffering?
It's not about sacrificing anything, Doc. It's about bypassing unnecessary pain. I understand that 6 months ago, I wouldn't have even considered this, but now I know this is right, and I need to pursue it no matter the cost.
This begs the question, is there anything to be gained from suffering? A utilitarian perspective might say that physician-assisted suicide is a way for patients to alleviate their pain. However, as end-of-life care options have increased, the ethics of when to allow physician-assisted suicide have become a gray area. Some physicians might say that patients should try another option.
Have you explored other options?
Honestly, no. I'm convinced nothing is gonna put me out of my pain except death.
Well, before we make such a big decision, I think it's really important that we discuss your other options. First, I can offer you palliative care, where we'll monitor your pain and make sure you have proper provisions for the end of your life. And I know this kind of sounds scary, but it is a collaborative relationship between your medication and your physician, and just a support from your fantastic medical team to keep you comfortable. Does this sound something like you're interested in?
Doc, no, honestly, I don't want to lay here drugged up waiting to die.
I can't believe you. You have another option and you're still refusing? I'll be in the fucking hall.
The decision the doctor makes in this moment will affect not only Elizabeth's life, but that of her sister Eleanor as well. Here's what a doctor in this situation might be thinking.
I want to respect her autonomy. This is what she wants. But how can autonomy justify euthanasia? How could she possibly understand the gravity of what she's asking for?
Autonomy does not automatically mean a patient should be able to do whatever she wishes, especially if that act will end the ability to act autonomously altogether. However, autonomy is just one of the 4 bioethical principles that will guide the doctor in his decision-making process. When you become a physician, you sign an oath to do no harm. This is called the Hippocratic Oath. This oath takes a strong stance against euthanasia, requiring the doctor's pledge to never give a deadly drug to anyone if asked, nor make a suggestion to that request. However, physician-assisted suicide has become an ethical gray area within this oath. Is it in a terminal patient's best interest to save them from their suffering through death? In the end, it comes down to the doctor's own moral compass.
Autonomy, beneficence, non-maleficence, justice.
The 4 principles of bioethics.
Beneficence is an act of kindness. Mercy. A beneficent perspective would grant Elizabeth this mercy, a right to die on her own accord. But non-maleficence states that I can do no harm. How can death cause no harm? Is it unacceptable? Or is being alive causing her much more harm than death could ever bring?
And then, there's justice.
Justice. There is no justice left for her in this life. Death may be the greatest justice I can provide her. No, not maybe. Death is unequivocally the greatest justice I can offer her.
Elizabeth, I'm willing to grant you this, but I think it's really important that you work things out with your sister first. You will need a support system through this process.
My sister is a stubborn, selfish, and frustrating individual. I didn't need her in life, and I sure as hell don't need her in death. I'm about to die in a week anyways, why does it matter?
Well, this process will probably take a little bit more than a week. It'll probably be closer to a month until you get mailed the medication. And you can take it either here in the hospital or in the comfort of your own home.
Oh, why do I have to wait that long?
Physician-aided dying is a very particular process. It has lots of steps to it. The first step is an assessment with your mental competence, and I understand that your primary physician has already completed this. The second step is a request. The patient must be the one to request, never the doctor. Once this has been done and the attending physician approves, a second opinion must be had, which is where I come in. I must make the final decision to grant your request now, and that's where we are right now.
And you're approving it, right?
Yes.
So what happens now?
Well, the next step is consent. You will need to fill out a lot of paperwork in the next few months and before you receive your life-ending medication. And you will also need to state that you are, like on the record, you are of sound mind and body and you are not being coerced by anybody.
Easy, I can do that.
Okay, once this is done, I will order the medication.
Thank you, Doc. This is exactly what I wanted.
Once you receive the medication, the final step is up to you. I cannot administer the medication, nor can I tell you to take the pills in any way. You can always change your mind. It's actually never too late. In fact, 1/3 of patients who obtain these drugs don't end up taking them.
Please, Doc, how much clearer can I be? This is what I want. I was ready to die yesterday, I'll be ready to die tomorrow, and I'll be ready to die till the day I take my last breath. Please, doctor.
Okay, I understand and I respect your decision.
Thank you, Doc.
Another thing to note, because your death will result from taking medications legally prescribed and obtained under physician aid in dying statute, your death certificate will list your underlying disease as your cause of death, not the pills.
Good, maybe that will give my sister some peace.
Elizabeth, this may not be my place to say, but I strongly suggest that you make peace with your sister. Your death will bring her no peace. It never does, even without the debt.
I know, you're right.
All right, I'll go prepare your consent forms.
Wait, Doc, thank you so much. This is exactly what I wanted. Ellie, could you come in here, please?